We are dealing with the different types of asphyxial deaths. Asphyxia is the deprivation of the oxygen at the tissue level and preventing tissue oxygenation through the lack of oxygen. Now, there are different types of asphyxial deaths that we have already dealt with in this lecture in detail. And in this last section, basically, we'll be dealing with two very important terminologies. That is the traumatic asphyxia, first of all. And then we have the postural asphyxia even over here. Now, the traumatic asphyxia, whenever we are talking about it, it is basically, it has got a very important historical background. There were two chain homicides, that is the Burke and Harry, and Burke used to sit on the chest of the person and Harry used to drag the person to cause the traumatic asphyxia, and they caused deaths to a lot of people through this traumatic asphyxiation method. Now, in this, basically what happens is the environmental conditions are quite favorable. The respiratory orifices are patent and the tracheal rings are patent, the lungs are patent, but there is severe trauma to the chest that is causing the person to basically deprive him of the tissue oxygenation. So this trauma is of a very severe type, and we have to keep that in our mind, that the severe trauma is the cause to the deprivation of the oxygen at the tissue level. And then we have the another kind, which is also known as the postural asphyxia. Now, postural asphyxia, we can refer to it as the different postures which a person attain and which can basically cause a deprivation of the oxygen at the tissue level. There can be different deformities which can lead to these postural asphyxiations, and we have to keep these basically in our mind. These terminologies have to be very clear. Talking about the autopsy findings, again, if we see the autopsy findings to any generalized kind of an asphyxial death, for example, the edema, the cyanosis, and again, the congestion of the veins or the arteries can be found, and the engorgement of the right side of the heart can again be seen in these asphyxial death, whether they are the gagging, whether they are the choking, or the traumatic and the postural asphyxia, whatever kind of deaths that we have to observe, these petechial hemorrhages, the histological and the chemical markers are going to be found in the dead body. On writing the autopsy report, you have to document all of these findings in detail, and you have to go through these findings to document or to diagnose your state, as the mode of death was the asphyxiation. Now, in this section, basically, we'll be dealing with the traumatic asphyxia. How do you define traumatic asphyxia? It is very important. Then we'll be dealing with the features of the traumatic asphyxia. What are the features that we are looking for whenever we are diagnosing any mode of death as the traumatic type? And then we are also going to deal with the postural type of the asphyxia. Now, the postural asphyxia, as we see, it is very common, and different types of diseases can contribute towards this postural kind of asphyxia. Now, how do you define the traumatic asphyxia? It is caused by an intense compression of the thoracic cavity, causing the venous backflow from the right side of the heart into the vein of the neck and the brain. So the levels of the obstruction can be over there. So the compression of the thoracic cavity is the mainstay over here. Severe trauma to the chest. It can be, what is the medico-legal aspects behind it? It can be of a homicidal type, and it can be of severe accidental type. For example, any severe chest compressions, the steering injuries, for example, can compress the chest and let the person not breathe properly. Again, it can be, for example, I can give you an example of a flail chest. Flail chest is basically multiple fractures of the ribs. They occur, and there is a paradoxical movement of the lungs, which can basically cause a deprivation of oxygen and causing the venous backflow from the right side of the heart into the veins of the neck and the brain. This is basically a whole kind of an obstruction. The movements are paradoxical, and that are going to interfere with the oxygenation levels. Then it acts by restricting the respiratory movements and thus prevents the inspiration phenomena. Talking about the traumatic asphyxia. Traumatic asphyxia is basically, it occurs in two conditions, that is, chest and abdomen are compressed by an unyielding substance or the object. So there can be a compression, or there can be a severe trauma to the ribs or the visceral structures that are going to contribute towards this traumatic asphyxiation type. And then we have the chest expansion, and the diaphragmatic lowering is prevented. For example, in stampedes, crushing in the crowds is basically a phenomena which is seen in which there are chest compresses, and the unyielding substance are usually the people, and that are basically going to compress the chest and cause the trauma of the person. Now, talking about the features of the traumatic asphyxia, we can see that it can be an intense cyanotic type, and we can see over here that there are numerous petechia on the scalp, on the face, on the neck, and the shoulder of the person. So the pulmonary carmine red edema is seen in such a person, and the fractures of the ribs and the other bones are also again very important. As I was talking about, there can be single fractures, and then there can be multiple fractures even involving a single rib. So that will be basically resulting in a flail chest, and a flail chest is basically defined as the paradoxical, it is going to result in a paradoxical movement of the chest, and that is going to be very fatal for the person. The pulmonary carmine are going to appear red edematous type, and the face of the person, as even you can see in this diagram, it is quite cyanosed, and there are numerous petechiae around the eyes, around the sclera, on the cornea. So all of these findings have to be documented whenever you're writing an autopsy report and you are suspecting that this death, the mode of death of this person was the traumatic asphyxia. Now, the internal organs are quite congested. Let it be the lungs, let it be the pleura, let it be the pericardium. All of these will be congested in a congested form, and the right side of the heart will be quite engorged. And that has to be noted down. And again, it is an obsolete tanquet. And again, there are a lot of arguments to these features. The subpleural petechial hemorrhages are found in such a case, and there are epicardial ecchymosis. Ecchymosis are again the tardo spots that are going to coalesce. We are going to term them as the ecchymotic areas. Postural hypoxia, how do you basically define this postural hypoxia? It is a form of asphyxia which occurs when someone's position prevents the person from breathing adequately. So there are a lot of causes to these postural kind of asphyxia. What are the causes to these postural asphyxia that we are going to discuss in detail over here? And it can be a trapped, drunken, or a drugged state. So the person can be intoxicated. Alcohol is one of the very important cause over here when we are talking about them. Then there can be a mechanical impediment. For example, a person is set in a posture that a mechanical force is basically, it can be of a homicidal type, that a person is in such a posture he is unable to breathe, and it causes the death of the person. The person can be trapped in a very congested or a suffocated place, and that is again going to cause this postural kind of asphyxia. Now, it is going to entail the inversion of at least the upper part of the body. So that is going to be documented whenever we are writing an autopsy report. So in this section, basically, we dealt with the traumatic asphyxia and the postural kind of asphyxia. What are the findings that we find in a dead person, the autopsy findings, how are we going to document them, that are discussed in detail over here. That is the end to this section. Thank you for watching sqadia.com.